things that we've achieved, and a little bit about where we're hoping to go in the future, the next year. I think it's been overall a very successful year for us in the past year. We've made quite a few changes, we've improved quite a few services, and we've done all of that against a difficult financial backdrop while still keeping the money on track. Perhaps one of the things that I'll mention first of all is that we've introduced the diabetes one-stop shops again. After a gap of a few years in South Tyneside, it was something that we were very keen to do when the CCG first was established. It's taken a little while longer than we thought it would do to get everything organised and done, but in the last year we have had the diabetes one-stop shops back in South Tyneside. They've been extremely well received, very popular, and we're certainly hoping they will continue for a long time. Another one of our priorities early on in the days of the CCG was mental health, and was to get improvements in a number of areas for mental health. In the first few years we saw the talking therapies team increased investment there, and better waiting times and so on for patients. What we've done in this year is extended that to children and adolescents as well, so that we now have a full life cycle mental health service for all ages, accessible via self-referral, telephone route, or by referral from GPs and other health professionals, or indeed from schools, teachers for young people as well. That's again been very well received. I have some very positive comments from schools, and I'm very pleased with how that has gone. In fact, our lead for commissioning that service was at a national awards evening only the other week. We were nominated for a national award for that very innovative service. So I'm very pleased that we're able to extend children and young people's access to mental health services within the last year. As part of that work, the previous long waiting times for more severe children's mental health problems have dramatically reduced, so that's another part of that work which has been very successful. Again, in mental health, we're part of a regional scheme looking at learning disabilities. Haven't seen a great deal of changes yet. That's still in the planning phase, though we would anticipate significant changes and improvements to that service in the coming year. Move on a little bit more towards long-term conditions and urgent care. We've seen Matthew Beattie come on board at the CCG as a new clinical director, and he's really been grabbing the bull by the horns there. Most of you will be aware that during the year we've made some significant changes to the urgent care landscape in South Tyneside, and probably the biggest thing that we've done in that area would be the relocation of the Jarrow Walk-in Centre. We never anticipated that being a popular move, though we were clear from the start in our minds that looking at that was the right thing to do to make sure that we could have access as good as we could make it for the whole of South Tyneside, and that by relocating that service alongside the emergency department at South Tyneside Hospital, we'd hope that we could give people a much better experience when they turned up for urgent care at that site. What we've actually seen this winter is that nationally, you'll probably have been aware on the news that A&E services have struggled, have been under horrendous pressure, and that waiting times across the country have not been what they should be. We saw some of that last year in South Tyneside, with people not being moved through the accident and emergency department as quickly as we would like. This winter, whilst the A&E department has dealt with ever more numbers and ever more complexity, they have actually done so whilst not quite meeting the national targets, but certainly seeing a lot more people through a lot quicker than they had the previous year. So this winter, whilst nationally things were a lot worse in many places, in South Tyneside, because of the action we took to move the walk-in centre service, things in A&E have been much better. There's still work to be done. in the acute hub, and getting the environment, getting the journey right. It's certainly not completely finished yet, but within the next year we will see further changes there, I'm sure. One of the other schemes that we've introduced alongside the relocation of the walk-in centre was the Think Pharmacy First scheme. This is the scheme that we've rebranded and relaunched that will allow patients who don't normally pay for a prescription to get drugs that would be normally available over the counter available free from a pharmacy without having to pay for the drugs just by going to the pharmacy, not by going to a doctor's to collect a prescription first. This means that patients are going to be able to access, and indeed have been accessing in relatively high numbers in the last year, advice from a pharmacist and free medication from a pharmacist, where previously they would have had to have waited for a doctor's appointment or gone to a walk-in centre or A&E appointment in order to access those drugs. It seems to be working very, very well, and we certainly intend to look at that in the next year to see whether there's any scope to extend that further and to increase the number of conditions that can be dealt with by the pharmacist. So I'm very pleased with the success of that scheme. We've also been working with the communities, our community teams. We've seen the rollout of what we call our integrated community teams. These teams are about district nurses, social workers, occupational therapists, community matrons, all coming together and working as one team rather than lots of different teams, so that patients will feel that they're being looked after by one group of people rather than many, have to repeat their story a lot fewer times, and be less handoff between team members than there used to be. We're seeing a lot of success where that model's been rolled out. We're now at a point where we've almost completed the rollout across the whole of the borough. The last year has been this gradual process of rolling it out from the original starting points in Jarrow and Hebburn across to the whole of South Tyneside. And we're now just about there. We'll undoubtedly see more changes in the next year in that, possibly with more services coming on board, possibly with greater integration with general practice. We're yet to see exactly where that's going to end up. We have been working with our practices a lot in the last year. We've been working to improve outcomes in a number of areas. Cancer is an important area in South Tyneside where people don't tend to do as well as in some other areas of the country. We've seen a lot of work being done in general practice to try to improve early diagnosis, particularly to encourage the uptake of screening and other interventions that we know improve early diagnosis, and we hope then will improve survival. Allied to that, we've seen a lot of work for people coming towards the end of their lives with general practice, being involved in trying to be more proactive in planning to give people the sort of end to their lives that they would wish to have. Nobody wants their loved one to die, but for some it is inevitable. In fact, indeed for all of us, it's inevitable that one day we will pass away. When the time comes, we want people to be in control of how things happen, and we've been working with general practice to try to make things better for people there. We've seen a lot more use of advanced care planning in general practice, so that people in their GPs are encouraged to have those sorts of conversations about what they want things to be like. And as a GP, the more I know about what somebody wants, the better chance I have of being able to give it to them. We've been doing work with our practices also on cardiovascular and respiratory disease. We know these two areas are areas where we still see a gap in South Tyneside of what our life expectancy maybe should be compared with the rest of the country, and we're looking with our general practices to what work we can do to try and close that gap. We've done some work with general practice as well over the winter last year. We took some national money to be part of a pilot of weekend GP opening over the winter. We're looking at what we learned from that and looking to see whether that's something that needs to be repeated or not. We've been involved in the ongoing Better You pilot programme, where as a South Tyneside partnership area, we're an integration pioneer nationally. That area is about self-care and changing conversations between people and professionals, from how can I help you to how can I help you help yourself, and changing conversations away from what's the matter with you to what matters for you. And that work's ongoing. That's part of a 5-year plan, in fact, that we're now still in the first half of that. So that's something that we've been involved in the last year, and will continue to be involved in with the rest of our partnership for the next few years. As part of our work with the National Integration Pioneer groups, we were partnered with Canterbury Health District in New Zealand to learn a little bit about their integration work in Canterbury. This has led to a very fruitful relationship with the people from Canterbury, and we are currently in the process of looking to implement a system called Health Pathways. Health Pathways is something that started in New Zealand, in Canterbury, then spread to the whole of New Zealand, and then spread to most of Australia, parts of Canada. And the Health Pathways team have chosen South Tyneside to be their first site in Europe to try out their way of working. Health Pathways is a web tool where GPs will, and other health professionals will be able to use a very easy to use website that will guide them and their patients through the difficult pathway of what should happen to them along a certain disease journey. That'll mean that patients and GPs will be able to see certainly much more standardisation of high quality care in general practice, and will help people reach the optimum route through the system, which we know can be very challenging for patients to navigate, and is certainly challenging enough for GPs to navigate with the sheer number of services that we have to deal with. We can't hold everything in our heads, unfortunately, but Health Pathways will help us try to get it right a lot more of the time by giving us that easy reference. I'm very pleased that we're going to be the first people in Europe to develop this tool and localise it to South Tyneside. So that will form a huge part of our work going forward in the next year. Looking forward a bit more to the next year, it's actually going to be a really tough year coming up. You'll recall that we're about a year on from a general election. Before the election, the head of NHS England published what he called a 5-year forward view. Within that document, he set out what the financial gap would be if the NHS continued doing what it has been doing for the last 5 to 10 years versus the then pledged public funding. That gap was about £30 billion. He also set out that the NHS could probably close about roughly £20 billion of that gap by working very differently, but it would still need significant extra funding. The politicians agreed to give it that extra funding, not the full 30 billion. So we're now going to be seeing a few years where we're going to have to make those significant changes in the NHS to allow us to live within the means that our population and politicians have decided we should be having. Don't underestimate the scale of that. And we've already seen the 2 hospitals in South Tyneside and Sunderland coming together to form their acute collaboration. And the next year will no doubt see further thoughts from them on how they can run their services together more efficiently. As I say, it's going to be a difficult year, but I'm sure that with all of the things that I've talked about already, with Health Pathways in place in the community, and with a strong GP sector in South Tyneside, as we develop that hospital model alongside our primary care strategy for the next year, we'll be very well placed to weather whatever storms are coming our way. Thank you very much.